Hi students, this is the demo for the carving of mandibular first premolar. As you can see, this is from the buccal aspect. After we make the first cut, the buccal and the lingual, then we draw the mesial aspect as the distal aspect, as you can see here. Here is the mesial aspect of the tooth. Then we cut off the excess saw. This is after we take the first and the second cuts of the tooth from the distal aspect and from the mesial aspect, and you can see the difference between the buccal and the lingual cusp tips. This is occlusally the usual box. This is after we take the corners of the crown. In taking the corners, we almost take the same amount from all line angles, the same amount from all line angles to give us the diamond shape for the mandibular first premolar. After we cut off the excess, we have to smoothen the crown, and then we have to draw, as you can notice here, the position of the marginal ridges. This is the distal marginal ridge, which comes in line with the long axis of the tooth, and you can see the cusp ridges. You can see here the cusp, the mesial marginal ridge, which is oblique and below the distal marginal ridge, and continues with the mesiolingual developmental groove. The mesiolingual developmental groove continues with the central groove. Here is after we cut off the excess from the triangular ridges, the distal marginal ridge at right angle, and you can see triangular ridges of the buccal cusp and the lingual cusp. And here is the marginal ridge, which is oblique and continuous with the mesiolingual developmental groove, and then runs occlusally to the central developmental groove, which has a C-shaped appearance. This is after we finished our model. You can see the difference between the buccal cusp and the lingual cusp. The marginal ridges, the distal marginal ridge at right angle to the long axis, occlusally diamond shape. The central groove is C-shaped, and the mesial distal triangular foci of the crown.
We should always name the surfaces as usual. The buccal, the lingual, we name them on the two smaller parts of the soap block, and the mesial and distal on the two larger parts of the soap block. Since it is a mandibular, if we are looking to the buccal side, the mesial should be on my right, because if we imagine that this is a mandibular premolar for a patient, this will be the right one. Now, as for the crown, buccally and lingually, the mesiodistal width of the crown at cervix is 5 by 2 from the midline is 10 millimeters from each side. The contact points are slightly occlusal to the middle of the middle, and it is 14 because it's 7 all in all, so by 2, 14 from each side from the midline that was drawn longitudinally on all the surfaces of the soap block. The cusp tip is towards the mesial of the midline, and we connect the points that were specified previously, and we get the shape of the crown from the labia, from the buccal, and also on the lingual side the same is done. Excess soap will be removed from all sides to get the final shape of the crown from the labial and This is a buccal view of the tooth after cutting the excess soap from all the surfaces. As we noted before, the cusp tip should be towards the medial. All excess soap should be removed from both sides so that we do not have excess soap in the middle as well as at the borders. Okay, now we draw the outline of the crown on the mesial side and on the distal side. The buccolingual width of the crown at cervix is 6.5 millimeters, so it is 13 from the midline from each side. The crest of contour is 7.5 millimeters from the middle, from all in all, so it is 15 millimeters from each side of the midline. The crest of contour buccally is at the junction of the cervical and middle, and lingually is middle of the middle. Now to locating the cusp tips. The buccal cusp tip is slightly buccal to the center of the crown buccolingually, whereas the lingual cusp is on line with the cervical outline of the crown. So we get the lingual overhang as you've taken in the lecture. After drawing both on the mesial and distal sides the crown outline, we cut the excess soap. As usual, we should connect the two cusps with a straight line, and later on we carve the central fossa and the triangular ridges. This is how the crown looks from the mesial and from the distal after taking the final step, which is the step for the roundation. As for the roundation, we start by drawing the buccal ridge on the buccal surface of the crown, which is centered. Okay. And then we cut excesses from the corners as usual. From the lingual, we remove more from the labial because the crown is tapered. The crown is slightly towards lingually from the lingual side. It tapers towards the mesial a little bit more. Looks constricted. So we cut the excess from both sides. As we said, from the lingual we remove more from the mesial than from the distal. Okay, and afterwards we start shaping the crown and creating the buccal ridge. By removing excess soap around it. Now we want to draw the occlusal surface in order to carve it later on. We start by drawing the mesial marginal ridge, which as you've taken is parallel to the buccal triangular ridge and is at a lower level than the distal marginal ridge, and it is connected on the lingual side with the mesiolingual developmental groove. The distal marginal ridge is at right angle to the long axis of the tooth, and it is at the junction of the incisal or occlusal and middle thirds of the crown. We connect them together at the area of the lingual cusp, and then we start creating the triangular ridge of the buccal cusp. We cut a little bit shorter than the triangular ridges, than the marginal ridges, to leave a little bit of soap for shaping later on. Okay, and then we start carving the the central groove of the tooth. As you've known from the lecture that the central groove is more towards the lingual and it is semicircular in shape. So we draw it first and then we start removing excess soap around it. We create the distal marginal ridge. The lingual cusp. And it is confluent with the mesiolingual developmental groove, as you can see. And then to the mesial triangular ridge. As we said, it should be parallel to the triangular ridge of the buccal cusp and at a lower level than the distal triangular ridge, distal marginal ridge. The mesial and distal triangular foci that are present on the occlusal surface of posterior teeth here are not triangular in shape, they look more like semicircular in shape. After finishing this step, we draw the cervical line. And this is how the final form of a mandibular premolar looks like. This is the buccal aspect of the finished tooth. This is how the mesial aspect should look. As you can note that the mesial marginal ridge is parallel to the triangular ridge of the buccal cusp, and it is continuous with the mesiolingual developmental groove. As you can see that the lingual cusp is a lot shorter than the buccal cusp. The distal marginal ridge is at right angle and is higher in level than the mesial marginal ridge. And this is the occlusal view. You can see that the tooth is a little bit constricted more towards the lingual, and it is more constricted on the mesial side than on the distal. It is a little bit broader.